Spina bifida is a congenital or present at birth condition which occurs when one or more vertebrae remain open, exposing the spinal cord. There are three types of this condition. Spina bifida occulta, which is the most common and mildest form, occurs when there is an opening in one or more vertebrae in the spinal column, though no damage to the spinal cord is present. Meningocele occurs when the meninges, which are the protective coverings around the spinal cord, protrude through an opening in the spinal column. The third and most severe form of spina bifida is myelomeningocele, which occurs when the protective coverings and the nerves of the spinal cord protrude through an opening in the vertebrae. Symptoms associated with spina bifida can vary depending on how severe the case of spina bifida is and the part of the spinal column that is affected. Some symptoms include bowel and bladder issues such as incontinence, constipation, and urinary tract infections, a loss of sensation and muscle paralysis at the site of the lesion and below, especially in cases when hydrocephalus occurs. Hydrocephalus occurs when fluid builds up around the brain and requires that a shunt be surgically implanted to drain the fluid and relieve pressure on the brain. Motor development, which is the development of bones, muscles, and the ability to move and control one's environment, may also be impacted, as well as cognitive development, or the ability to think and understand. Management of spina bifida usually begins within 24 hours after birth, since this is when it is usually first noticed. Depending on the severity and which part of the spinal cord is affected, there are different treatment options. Surgery to close the opening, reconstruction of spinal deformity, and lower extremity correction can greatly improve quality of life. Physical therapy can be useful to help the person achieve gross motor skill development as a physical therapist monitors posture, alignment of joints, and the possible shortening of muscles, tendons, and ligaments. The physical therapist will also monitor the neurological functioning to assess any abnormalities that may be present. And physical therapists can also demonstrate positioning techniques and make recommendations for assistive devices that will aid in one's ability to function, such as a wheelchair. An occupational therapist can assist a person with spina bifida through techniques to facilitate hand-eye coordination and upper extremity stabilization. An occupational therapist teaches a person how to use assistive devices and develop the skills to achieve activities of daily living, such as dressing and bathing. In some cases, an individual with spina bifida will experience limited movement, which can have a negative impact on one's self-esteem and healthy development. A recreational therapist can help an individual participate in recreational activities and interact with peers. Parents of children with spina bifida often struggle with stress, depression, grief, and may feel overwhelmed and uncertain about their abilities to raise a child with spina bifida. Some studies suggest that parents of children with spina bifida are overly controlling and intrusive as they try to protect the child, as is the case when parents withhold information as they are afraid it will upset the child. Siblings of children with spina bifida often become concerned with their siblings' health and how spina bifida affects their life. Siblings also tend to develop a greater understanding of disability and learn to appreciate their own physical abilities, assuming the sibling has normal physical functioning. Persons with spina bifida may be socially immature and have fewer friends and have low self-esteem as a result of lack of social and peer interactions and overprotectiveness of parents. Individuals with spina bifida are at a greater risk of becoming dependent on others and failing to develop independence and resilience. It is critical that parents of children with spina bifida seek supports from the therapeutic fields mentioned to aid in healthy adjustment and development. Rehabilitation counselors help the individual and family members of persons with physical and emotional disabilities through a series of therapeutic approaches. Rehabilitation counseling focuses on empowering independence, inclusion, societal integration, and advocacy for persons, families, and groups affected by disability to facilitate healthy adjustment to disability. Social and peer interactions are highly important in the development of self-identity and one's ability to be positive about the future. For one to adjust to spina bifida in a healthy manner, it is crucial that they receive family and community support that fosters autonomy and the development of a healthy self-concept. The therapeutic disciplines and approaches that I have discussed, when used in addition to rehabilitation counseling, are important factors which can enhance one's response to spina bifida. There are numerous support groups such as Spina Bifida Association and Spina Bifida Connection, which can be found through an internet search or through the assistance of human service agencies. These organizations focus on providing support, further education, and resources for healthy lifelong adjustment.